Thank you everyone to join this ISSS. We all know this is the outline. I will cover my talk is include three parts. So first of all, I would like to talk about the global COVID-19 pandemic. Everyone knows, and actually everyone experienced this special infectious disease, which has impacted globally substantially. And so far, we have globally the instance of the COVID-19 is 3%. Every 100%, 3 of them has been infected by the COVID-19. And because of this infectious disease from the initial of this COVID-19 last year, we in order to contain this disease, we try globally, and everyone in every country try to contain this disease with the non-pharmaceutical intervention for COVID-19, such as lockdown and social distancing and many strong, very strict measures. So that also affects the medical, the healthcare activity in hospital. In some cities, it's even lockdown, and people have to work at home, study at home. So for the so-called non-essential care has been stopped or halted for a while. And because of this, for example, this is a study from the Netherlands. In the upper part, you can see the epidemic curve in Netherlands last year. So we will see the first surge of the COVID-19 in March, and between March and May has affected the Netherlands quite a lot. Therefore, in the lower left part, you can see the patient operated in multiple centers involving 200 patients has been the purple line. We can see it has dropped a lot, especially for the conservative surgery. And we also noticed that the breast cancer cases detected by the nationwide screening program has been dropped a lot, and the most affected group is those with a lower, for example, smaller breast cancer or nose negative, and also we can see the results from the Canada. Professor Linda also mentioned this morning in 2020 in Canada. They experienced the COVID-19 again, a further surge, and after September, the Alpha VOC has affected the Canada a lot. But look at the so from the beginning, even the smaller surge than the later. But from the beginning, in March, they started to delay the screening, and after June, they resumed this screening procedure activity. And we can see it has been reduced by 70%. In the resume period, it's recovered a bit, but still affects. The screening volume has been reduced by 40%. But they here you can see the although the figures drop, but in the later months they try to prioritize the health activity. For example, for a higher risk group, it's even the examination performed more than in 2019, but affected for the general population. What do we have in Taiwan? In Taiwan, we have the screening program for breast cancer, oral cancer, colorectal cancer, and cervical cancer. Let's see, here is the figures before COVID-19. Between 2004 and 2019, as you see in the morning section, we have a quite similar figure for colorectal cancer and also for breast cancer. The screening volume has increased year by year after a rolling period. Until now, we almost serve 1 million women every year in Taiwan. And since 2010, we started to introduce the mobile unit for mammography screening. And even in 2019, the service from mobile mammography has been outnumbered of the fixed unit screening. Here is the COVID-19 we have. You can see the numbers here. The curve. In Taiwan, we experienced a high peak of COVID-19 in 2020 between March and May as the first surge globally. But the number are most of them are imported case. We contain very good, and we don't have a community outbreak in 2020. The total number is 800. Here is the what we have in 2020 for the screening volume. We can see that the screening, the proportion of screening has been dropped by about 30% between in March when the imported cases start to grow. Also, it's less than 30 per day, and overall the screening has been reduced. The total screening volume has been reduced about 30%. Then we go to the 2020 this year, and for this year, unfortunately, although we still contain the disease quite well, but we have a community outbreak during the alpha VOC attacked the started to surge, and this community outbreak has affected our government, and we start our national level 2 alert on May, and in 2 weeks we launched the level 3 alert. So between May and July, we actually have a quite strict regulation for people, although not lockdown, but the hospital has been shifted the health worker to work on the anti-viral task. So this is the influence of the COVID-19 in 2021. The death rate you can see during the alert level 3 between May and July, especially the June and July. We almost have a non-screening activity. And although after that, we started to try to catch up the screening volume, but still until the end of September, our screening volume has been affected by almost reduced by 40%. And not only the screening which we are concerned, but also the outcome. And before that, I also would like to show you the difference in the hospital examination and also mobile mammography. You can see for the mobile mammography, it's almost overwhelming affected in June and July. Almost none of them has been conducted. So not only the screening volume, but also the screen detected cases. Between June and May, there's not much difference in the 3 years. But between the June and September, you can see this year, we have almost 90% reduced the screen detected breast cancer being diagnosed. And not only the number, but also the distribution of the stage. In a very last column, you will see the stage 4 and stage 3 has been enlarged compared with the other corresponding box. So here we worry about the outcome, and also the missing box here. They could be, the distribution could be of the stage could be like this, or they already like this, or it's even worse. So this is what we want to remind everyone when the COVID-19 has been controlled so far, the vaccine has been distributed, the new technology of the antiviral therapy has been invented. When we start to think to resume all this screening activity, we need to find this missing puzzle. And not only the breast cancer, here is the colorectal cancer. Before COVID-19, we served 1.4 million FIT screening every year. But after the COVID-19, it has dropped our screening volume in 2020 and also in 2021. And different from breast cancer, colorectal cancer, because the cases with positive result has to go to the hospital for colonoscopy. Therefore, the referral rate has been heavily affected for colorectal cancer with the colonoscopy. That's why the number of detected colon cancer has been reduced even about half by half. And also the oral cancer screening. But for the oral cancer screening, our case yield is not less affected compared with the other two. So in the period after the COVID-19, we started to think about how to lift our containment measures, especially like the for example, in Taiwan, we have the outbreak between, especially in May and June. But we start to we are now under well control. So we are thinking we need to resume the screening. But at the moment, what we need to pay attention, we still need to try to prioritize all the referral for those backlog from the previous months. For example, this is for the breast cancer. In between January and September, we estimate there could be 600 breast cancer left behind. They should have been early detected, but they are not now so far. So if we for time being to digest so many non-referral cases, if it is difficult, then we need especially to prioritize. For those already by rates 4, 4C, and 5, we cannot meet them for any more delays. So this is the impact. The impact for COVID-19, not only those die from COVID-19, but also for those who experience cancers and the opportunity to detect them earlier. And so here is my summary. We have experienced a substantial influence of the declined screening volume, lower referral rate, fewer screen detected cancer, and unfavorable stage distribution in COVID-19 pandemic period. So the prioritized screening has been considered. And most importantly, we need to evaluate the long-term impact on the cancers with more sophisticated methods in order to guide the government how to do the better prioritized screening in a short period, and how to assess the long-term outcome. So here's my presentation today. Thank you very much.